This video is a continuation of the previous video on preterm labor, and in this video I'll be discussing the signs and symptoms of preterm labor, what to do immediately experience these symptoms, and at the end of it I will highlight the complications associated with preterm labor for both the mother and the baby. So make sure you watch the entire video. Now, the signs and symptoms of preterm labor can vary from woman to woman, but there are several common indicators to be aware of. Here are the key signs and symptoms of preterm labor. Number 1, regular contractions. Preterm labor typically involves regular uterine contractions that occur more than 5 times per hour, more frequently than Braxton Hicks contractions, and are accompanied by a tightening or hardening of the abdomen. These contractions may be painless or mildly uncomfortable initially, but can become increasingly intense. Please subscribe to this channel. Number 2, menstrual-like cramping. Women in preterm labor may experience cramping similar to menstrual cramps. The cramps may be constant or come and go intermittently. Number 3, low back aches. Persistent or intermittent pain or pressure in the lower back can be an indication of preterm labor. The ache may feel like a dull, constant discomfort or sharp shooting pains. Number 4, pelvic pressure. A sensation of increased pressure in the pelvic area, as if the baby is pushing down, can be a sign of preterm labor. Pressure may feel like the need to bear down or as if the baby is about to come out. Number 5, vaginal bleeding or spotting. Vaginal bleeding was the sign I experienced during my time 3 years ago. Any vaginal bleeding or spotting during pregnancy, especially before 37 weeks, should be reported to a healthcare provider immediately. While spotting can occur in normal pregnancies, it can also indicate a problem such as preterm labor or placental complications. Number 6, change in vaginal discharge. An increase in vaginal discharge that is watery, mucus-like, or bloody might be a sign of preterm labor. The discharge may be different from the usual pregnancy discharge and may be accompanied by a gush of fluid. Number 7, ruptured membranes. If the amniotic sac ruptures, causing a gush or continuous trickle of fluid from the vagina, it is known as the rupture of the membrane or water breaking. This can be a sign of preterm labor and requires immediate medical attention. Number 8, intestinal disturbance. Some women experience gastrointestinal symptoms before or during preterm labor, including diarrhea, nausea, vomiting, or an upset stomach. If you experience any of these signs or symptoms, it is important to immediately get to the hospital to avoid further complications. When a preterm baby is born, it is taken to the neonatal intensive care unit because preterm babies require specialized care where a multidisciplinary team of healthcare professionals provide support for their unique needs, including respiratory support, temperature regulation, feeding assistance, and monitoring for complications. Now, this special care is important because of the potential health complications of premature birth for both the baby and for the mother. For the preterm babies, they are at the risk of 1, respiratory distress syndrome, RDS. Babies born prematurely often have underdeveloped lungs and may experience difficulty breathing due to insufficient surfactant production. RDS can range from mild to severe or may require respiratory support. Number 2, intraventricular hemorrhage. The blood vessels in the baby's brain may be fragile, and the risk of bleeding into the brain's ventricles is higher in preterm infants. The sensitivity can range from mild to severe, potentially leading to long-term neurological complications. Infections. Premature infants have an increased susceptibility to infections due to immature immune system and reduced protective barriers. Developmental delays, including cognitive, motor, and language delays. Long-term health issues. Preterm babies have an increased risk of developing chronic health problems later in life, including respiratory, vision or hearing impairments, neurodevelopmental disorders, and cardiovascular issues. Other complications include feeding difficulty, temperature regulation issues, jaundice, etc. For the mother, preterm labor increases the risk of developing infections in the reproductive organs, such as pelvic inflammatory disease, which can lead to long-term complications if not treated promptly. Postpartum hemorrhage, which is excessive bleeding after childbirth. This is higher in women who deliver preterm due to the uterus potentially being less prepared for contractions and placental detachment. Emotional impact. Preterm birth can be emotionally draining for the mother, leading to increased stress, anxiety, and postpartum depression. Don't forget to like this video and please subscribe to this channel.